I'm Eileen, and I'm an occupational therapist. I have a little business called Bega. Biggie Gives Advice, because that's what I do all the time. I don't know if you can see the back of that. Anyway, I'm kind of on a roll, and I jacked on coffee, so I am going to make a little video about some of my pet peeves that I see in occupational therapy all the time. I've been doing it for a really long time. Let's just say I was pregnant with my first kid when I took my test, and he's going to be 31. But no more about that. I'm going to just list them off. I came up with 10 really quick. Probably each one of them I could talk for 30 minutes on, but I'll spare you that. All right, the first one, my first occupational therapy pet peeve, I call PT light. A lot of OTs, I feel, don't really want to be OTs. They want to be PTs, except they don't want to be PTs with the big muscles. They just want to do little things. And you'll hear this. Oh, PTs for the lower half of the body and OTs for the upper half of the body. I reject that totally, because that would be the stupidest job of all time. Occupational therapy does entail some exercise. If you see that they can't open a jar because their hands are weak, or they can't lift their arm to reach the grab bar, yeah, then go ahead and exercise that. But for the most part, we're not exercise. So your occupational therapy should not be wheeling down to the clinic and doing upper body exercise and then getting spirited on back to your room. I could talk more about that, but I'm going to go on to number 2. I'm going to keep this to 5, and if I need to make another one, I'll keep going, which I kind of think I could do this all day. So anyway, the second pet peeve that I wrote on my list here, I call push and play. What that is, I see a lot of, and I'm not slurring anybody, sometimes they just don't know, and with the productivity and all those kind of things, you don't really get a chance to be overly creative. So a lot of this is that, and I'm not slurring anybody, so don't take it that way. But anyway, back to push and play. This is when the therapist goes out to the resident's patient's bedroom, gets him in a wheelchair, pushes him down there, pushes him up to the table, gives them something to do at the table, and then when they're done, pushes them back. Okay. First of all, if it's a long-term care person that lives there, that's what they do all day. All day long, they sit in their wheelchair and have something in front of them. Well, if they're lucky for that, okay? That's not occupational therapy. You have to get them up, get them out. And let's say it's a person who's going to go home, and you wheel them down, and they do the thing, you wheel them back. When they go home, how are they going to get where they got to go? How are they going to get there? You're going to be there in their house, and you're going to push them to the table, and then you're going to push them here and push them there? The most important thing they need to learn is how to get here and get there. That's what gets them. They're not going to be sitting at home, doing some therapy or matching socks and then just boom, right out of the chair. No, what's going to get them is trying to get from here to there. Oh my goodness, I got to go there and get my chips. Boom. That's when they're going to get down. So they need to work on all the transitions. You can't just push them in, have them do some stuff at a table, and go. A lot of them call that tabletop therapy too. So, all right. Here's another one. That the concept that walking is PT. Walking is physical therapy. I heard this interchange just yesterday when I was at work. The OT says to the PT about the fella that the PT just brought in. Oh, I'm sorry I walked him. I was just trying to loose him up, and now he's tired. The PT was a little bit upset because the OT had tired out her guy, so she couldn't walk him. Well, how does that make any sense? When he goes home, he may have to walk in the morning to the bathroom, and he may have to walk again in the afternoon to make his lunch. So if the OT has to get him out of the chair, they have to walk him. Walking is a part of life. It's a part of your you're not supposed to be designing your treatment to make it convenient for you, the therapist, and to not wear them out for the next guy. They need to practice the skills that they're going to do at home. And walking is one of them. That's how they fall. They fall getting up, sitting down. Now, granted, as an OT, you're not going to walk in the same manner or with the same focus that the PT does. The PT is going for distance and all this other kind of stuff. But OT will walk them to make sure they're safe. You got to make them open a door. You got to make them step around the sock on the floor. Make them, see if they can reach down and open their drawers. Or how about energy conservation? How far can they walk before they get tired and turn around? When they go home, they're not going to have a wheelchair under their dupa so that they can just plop down anytime they want. You got to practice with them. All right, buddy, you're going to walk as far as you want, but remember, you got to come back. Okay, so that's a huge thing that OT needs to work on, because I have people all the time. They're doing really good. They're walking 150 feet in therapy. They got that chair under their rear end. Anytime they get tired, they can plop on down. Well, the first time they're on their own, or I get this all the time. Oh my gosh, usually I have the chair behind me. Well, I got news. When you get home, you're not going to have that chair under your butt. We better practice this. Okay, so those are my first 3 pet peeves. PT light. PT being just an easier version, or OT being an easier version of PT. No, that's not what it is. There's a huge creativity education component. Okay, my second pet peeve was the push and play. Push them into the table, they play at the table, you push them back. We got to be more than that. We need to get them up. We need to get them on their feet. We need to use those gross muscles, because you know what? That's what life is, and OT is life. All right? The third one is related. Walking is PT. No. Walking is life. People walk in life. They stand in life. They need their legs. I know I'm an OT and I'm supposed to care about arms, but the most important muscles in there are them thigh muscles. Okay? So those are my first 3. I think I might have to make another couple more of these. Thank you for listening.